Growing older comes with changes we expect. The joints ache a bit more, memory takes a pause, and doctor visits become routine. But one part of the body is often left out of those conversations: the penis. Just like your heart or your bones, it ages too. And when it's ignored, the consequences go beyond function. What fades can also include your confidence, your sense of dignity, and your connection to others and yourself. I'm Dr. Michael Huddlestone, with over 30 years' experience in men's health, specializing in helping older men maintain their sexual health. I've spent decades helping older men protect not only their sexual function, but the part of their identity that's tied to it. Here's a question worth asking. What if the most common cause of erectile problems in men over 60 had nothing to do with age itself? And what if the answer wasn't found in a prescription, but in the small things you do every day? In this video, I'll share 5 essential science-backed ways to care for your penis, each one practical, tailored for men over 60, and proven to make a difference. Stick with me until the end, and I'll also share a bonus tip, one most doctors rarely mention, though it could spare you from one of the most painful and preventable conditions I treat. Before we begin, take a moment to subscribe and tap the bell. That way, you'll never miss straightforward, age-specific health advice designed for men like you. One of the most common things I hear from men in their 60s and beyond sounds something like this: "I guess my sex life is behind me now." Many quietly accept this idea as a natural part of aging, assuming there's nothing they can do about it. The trouble is, this belief can become the very reason things begin to decline. Your penis, like your muscles or your heart, depends on regular use to stay healthy. When it's left inactive for too long, blood flow starts to decrease, elasticity weakens, and tissues begin to break down. This process, which we refer to in medicine as penile disuse atrophy, isn't rare. It's surprisingly common. The encouraging news is that it's also reversible, and even better, preventable. Sexual activity, whether with a partner or on your own, supports more than pleasure. It's part of maintaining the health of the tissues and nerves that make sexual function possible. When blood continues to flow to that area, oxygen and nutrients keep the tissue alive. It's similar to stretching a joint or muscle. Use it consistently, and you preserve range, flexibility, and strength. For those who find intercourse or masturbation challenging, there are other options. Medically approved vacuum erection devices can help maintain function. So can pelvic floor exercises, which many men overlook, but which have been shown to support performance by improving blood flow and control. The main idea here is simple: stay engaged. The body continues to respond to stimulation throughout life. And beyond the physical benefits, staying active this way can restore confidence, strengthen identity, and remind you that your sexual self still matters. You don't need to be who you were at 25. The goal is to stay connected to who you are now, a man with experience, with wisdom, and with every right to feel strong in his own body. On the surface, washing up might seem like the simplest part of self-care. But for older men, the rules change. After treating thousands of patients over 3 decades, I can say with confidence that proper penile hygiene remains one of the most neglected aspects of health. And it's not due to neglect. It's often due to not knowing how your body changes with time. As skin thins and immune response slows, what once passed as good enough hygiene in your 30s may not hold up in your 60s. Minor irritations become more common, and infections gain ground faster. If you're uncircumcised, this risk increases as sweat, bacteria, and skin cells collect under the foreskin. Without proper cleaning, conditions like balanitis can develop, and in some cases, poor hygiene may raise the risk for penile cancer. In countries like Brazil, where rates of this cancer are among the highest, inadequate hygiene is often the leading cause. The solution is straightforward. Use warm water and mild, fragrance-free soap. If you're uncircumcised, gently retract the foreskin and rinse thoroughly. After washing, make sure the area is fully dry, especially in the folds where moisture lingers. Moisture provides the perfect environment for bacteria to grow. And after intimacy or self-stimulation, clean again. Fluids and lubricants can disrupt the skin's natural balance. These small habits can protect you from pain. Men who take consistent care of their genitals report feeling more confident, more in control, and more dignified. In a world that too often tells older men to let go of their bodies, this one habit helps you stay connected to it. 3. Be fully erect before penetration. There's a quiet risk most men don't recognize until it becomes a visible, painful problem. Having sex without being fully erect isn't just uncomfortable, it can cause damage. The penis, at rest or partially aroused, doesn't have the firmness needed to handle the pressure of penetration. Soft tissues and blood vessels are vulnerable. When they're forced before the penis is ready, those tissues can tear in small but meaningful ways. We refer to these as microtraumas. Although they don't usually hurt right away, over time, they can form scar tissue beneath the surface. As that scar tissue builds, it begins to pull on surrounding tissue. The result? A condition called Peyronie's disease, a bend or curve in the penis that makes sex painful or impossible. It's more common than most realize, especially in older men. And sadly, it's often not discussed until treatment becomes more complex. If you use medication or devices to support erections, give them time to work before proceeding. Use lubrication. Focus on foreplay. Talk to your partner if you feel pressure to rush. These adjustments might feel small, but they make a lasting difference. Choosing to wait until your body is fully ready isn't a sign of weakness. It's a sign of wisdom. You're protecting your future comfort and function, and that's worth the patience. Access to pornography has never been easier, and many older men rely on it more than they'd care to admit. For those who are single, widowed, or simply feeling disconnected, it can feel like a safe and private outlet. But there's a catch. The brain adapts. Consistent exposure to fast, intense, and purely visual stimulation rewires the mind. It begins to associate arousal with fantasy alone, and real-life intimacy starts to lose its spark. I've met many men in their 60s and 70s who tell me they still want to be intimate, but their body won't cooperate. Often, it's not a hormone or blood flow issue. It's a matter of psychological conditioning. This pattern, known as desensitization, can lead to low libido with partners, performance anxiety, or a sense of disconnect from your own body. It can also stir feelings of shame, especially when solo habits begin to replace emotional closeness. The goal isn't to shame or blame. It's to suggest a shift. Gradually reduce the use of porn, and try rebuilding natural arousal through imagination, memory, or emotional connection. It might take time, but the benefits run deep: stronger erections, greater intimacy, and a renewed sense of self-worth. Intimacy doesn't vanish with age. It just asks for a different kind of attention. 5. Your lifestyle is your best prescription. Too many men come into the clinic hoping for a quick fix, a pill that'll bring things back. While medication can help, it's never as powerful as the daily choices you make. Sexual function reflects overall health. Erections depend on blood flow, and blood flow depends on your arteries and heart. If those are damaged by smoking, inactivity, or poor diet, your sexual health will show it. Erectile dysfunction is often one of the earliest signs of cardiovascular disease. When your penis stops responding, your heart may be calling for attention too. There's good news though. Small changes bring big returns. Walk for 30 minutes each day. Eat greens, berries, and healthy fats. Cut back on alcohol. Stay hydrated. In my experience, men who take these steps often notice changes within weeks. They feel more energized, more capable, and more like themselves again. And because they've built their improvement on a lifestyle foundation, the results last. Rather than reaching for another pill, reach for your walking shoes. You'll be surprised by how much your body remembers. Bonus tip: sleep without underwear. Here's something simple that can make a quiet but meaningful difference. Give your body space at night. During sleep, men experience spontaneous erections. It's a normal part of the sleep cycle and helps keep the erectile tissue healthy. But when you wear tight underwear, briefs, or snug-fitting pajamas, you may be restricting that natural blood flow. Over time, that pressure can lead to irritation, poor circulation, or internal scarring. This becomes especially important with age, as healing slows and small issues become bigger ones faster. Sleeping in loose-fitting boxers, or nothing at all, gives your body the freedom it needs to repair itself without unnecessary compression. It's a small shift, but for many men, it supports long-term comfort and function. Everything we've talked about: staying active, washing properly, Protecting yourself during sex, managing porn use, choosing a healthier lifestyle, and yes, sleeping in the right clothes isn't just about performance. These are quiet acts of respect. They say, "I still care." And they remind your body to keep showing up for you. You don't need to chase youth to stay whole. You simply need to stay present with who you are now and give yourself the kind of care that reflects that. I've had the privilege of helping countless men reconnect with their confidence, not by turning back the clock, but by tuning in to the present. If something in this message spoke to you, share it with someone you trust, a brother, a friend, a father. And if you haven't already, subscribe for more honest, respectful conversations about men's health. Your body is listening. Thank you for choosing to listen to it too.